And welcome to The Pulse. My name is Brady Kerkman, Executive Director of Marketing and Business Development. And with me today joining is Dr. Kendra Kamlitz.
Yes.
How are you today?
Wonderful. Thanks for having me.
Excellent. Well, nothing like hitting the ground running. You've been at Windom Area Health how long now?
3 days.
3 days. So we wanted to really seize that moment and talk to me a little bit about, where'd you come from and kind of your background.
Sure. So I currently live down by Fairmont. I actually live between Sherburne and Welcome on Fox Lake. I was previously practicing in Fairmont as a general surgeon there. I'm originally from North Dakota and kind of been bouncing around the Midwest between work and training.
Excellent. So what brought you to Windom Area Health?
So there are a lot of attractive things that brought me to Windom. I was looking for an opportunity change from my last practice, and I love working in smaller communities, and my passion really is rural general surgery care. And so this was just a wonderful opportunity to work with a community-owned facility and organization, really focused on the needs of their communities. So that was really attractive to me. I also am looking forward to adding the Da Vinci robot back into my practice. It hasn't been available in my practice for the last few years, so I'm really excited about that opportunity here.
Well, and just for a quick brief, for those that don't know what the robot is, can you tell us a little bit about that?
So the Da Vinci robot is a surgical robot. It's a tool that we use in the OR to allow us to do really kind of high definition, minimally invasive surgery. Minimally invasive surgery has been around for a long time. It's usually been laparoscopic surgery in my realm, which are straight instruments that don't bend. The robot adds in 3D visualization and instruments that have wrists at the end and bend, so you can do really detailed work through tiny little incisions, and so it makes it a really useful tool and really game-changing when it comes to the minimally invasive surgeries that we can do.
And I think it has a big impact on the healing time and process as well, doesn't it?
Yes, it allows us to keep a lot more of the surgeries that we would otherwise have to make a big open incision. We can keep those minimally invasive, keep those to those little incisions, which does dramatically shorten that recovery time.
Well, so, one of the things when I'm out doing some business development, it is very clear to me that you have a strong positive reputation from your current practice. And tell me how you intend to kind of build that here in the Windom community.
So my focus is always on patients and what is their need in the encounter that we're dealing with. People are coming to me in a time in their life which is very vulnerable and very unknown. And so that is always at the forefront of my mind, that we want to keep patients comfortable, explain the process as thoroughly as we possibly can, so there's no scary things that come up that they're not going to be aware of, to the best of my ability, and really work with them through every step of their time with me.
And the general surgeon, I'm sure there's a number of surgeries you provide, but what would you say would be some of your common ones that you see most often?
So general surgery is a broad spectrum specialty, which is why I love it. But a lot of it focuses on intra-abdominal surgery. So things like gallbladder and appendix and bowel surgeries. Hernias are very common. Also on the non-surgical but procedural side, a lot of endoscopy, such as upper endoscopy of the esophagus, stomach, and colonoscopies as well on the bottom side for colon cancer screening. And then I like to do a lot of skin surgery as well, skin cancers, lumps and bumps on the skin, and breast surgery as well, mostly for breast cancer or for other breast masses.
Unfortunately, breast cancer it seems to hit far too many people.
Yes.
I can say, you've talked about it a little bit, but tell us a little bit more about how you connect with your patients.
So for me, connecting with my patients starts at that first interaction. So when they come in, having that first conversation face-to-face, sitting down and hearing their story, what's been going on in their own words, I think that really sets the stage for making sure that we are getting to the root of what their need is when they're coming in and seeing me, and then just continuing that same tone throughout the entire time. I love to take and spend that time with patients and give them as much time as we possibly can, so that I really have a clear understanding of what they need and what we can do together.
Well, excellent. I know as far as Windom Area Health, we are excited to have you join our team, and I know the community will be excited to have you here. I've heard a lot of positive things as well. They're excited for you. So with that being said, we welcome you, and we thank you for joining us today on The Pulse.
Thank you.
And until next time.